Hi, everyone. My name is Sarah McLean, and I am a two-time breast cancer survivor. I'm really grateful for the opportunity to be here today to share my story with you. In 2003, I had been doing self-exams for several years. I was 25 years old, and really I was only doing the exams because my gynecologist had told me that I needed to start learning what my tissue felt like. And I noticed that there was something different on my right side, but I really didn't think it was anything. Honestly, I thought it was probably a cyst. And so I had recently moved to Oklahoma City from Dallas. My husband and I had only been married for a year, and I hadn't found a gynecologist in this area yet. So a friend gave me a referral to her doctor. So I went and visited with her, and she assured me that it was really nothing and I didn't need to worry about it. And I believed her. She was the doctor. And so I left, and 6 months later, I had noticed that it started to become tender to the touch. And I didn't think it was anything. I had really convinced myself it was a cyst, but my husband thankfully was insistent that I really should go get it looked at again. So he went with me, and because of my age, she was pretty reluctant to give me a referral for a mammogram. And honestly, I felt like she was treating me like I was a hypochondriac and that it really was nothing to be worried about. But thankfully, she did give us a referral that day, and we left. And I still had convinced myself it was nothing and put it off. So a couple months went by. At this point, I had turned 26 and went for the mammogram. And for me, it was pretty awkward being the youngest person in the room. I really felt like I was out of place and that I had no business being there. And I went in, had the mammogram, and was waiting on the radiologist to come in and tell me everything was fine. And the nurse had come in, and at that point, it was like a whirlwind because the doctor had come in and started talking to me about how they saw calcification on the mammogram and that they were concerned and wanted to do a biopsy. And really, it was like it was going in one ear and out the other. I started to just kind of be on an emotional roller coaster. And they had called to have the biopsy the next day. I came back, and they did the biopsy. And a couple days later, they called, and I remember being in my apartment by myself at the time, and they called, and um, they advised that it was breast cancer, and they had already contacted a surgeon, had already set up the appointment for the consultation. And so I'm sure, like many of you, you're in disbelief and it feels surreal, like you're living in a dream. And at that point, I just started doing what they told me to do. I was going to the doctor's appointments, getting the consultations, and all the while wasn't really processing emotionally what was happening. And my husband and we ended up doing a lumpectomy. I say we because the way I look at it is that we both are going through this together. And I did a lumpectomy at first with the intention of having radiation afterwards. And they had biopsied the surrounding tissue while they were in there. And the next day, they had called and told me that it was still cancerous in the cavity. And at that point, they had recommended that I do a double mastectomy. Again, it was 2003. There was a lot of different ideas and protocols at the time. And just to be safe, I think, and I was the youngest one in the state at the time. Unfortunately, I meet so many young women now that are much younger, but we decided that we would go ahead and do a double mastectomy just to make sure that we got every cell, that we were reducing any potential risk. And so the following week, I was back in surgery. This would have been June 5th, 2003. And I decided to do implant reconstruction. And so I went in, we had the double mastectomy, and they put the expanders in. And I was in recovery, and my husband was sitting next to me. I remember coming out of anesthesia and holding his hand, and I just looked over at him and him smiling, and I guess I fell back asleep. And I didn't realize it, but apparently I had overdosed on morphine and flatlined, and um, they ended up having to come in and revive me, and I had a lot of complications from the drugs. And so it was just a hard recovery from the get-go. Once I got home, though, started recovering. My family was there for me. My husband, we stayed at my parents' house just to help because he had been laid off the same week that I was diagnosed. So there was a lot going on personally. And so from there, um, 6 weeks I was out of work, and I decided it was time to go back at that point. And I was doing the expansion process, going every other week to have the skin stretched. Thankfully, we had caught it early enough that I didn't have to do chemotherapy and radiation. The tumor was not estrogen induced, so I didn't need to do any kind of hormone blocker. I was really grateful for that, especially with how my body responded to drugs. So we just kind of started trucking down the road, tried to resume a normal life. We didn't have children. I was working full time, and I quickly realized that um, I wasn't okay. Uh, Probably, I would say 6 months after going through the expansion process, I started to feel isolated, and I really started feeling very alone, that I couldn't relate to anybody around me. Um, with people at work, I felt like they looked at me differently. They didn't know what to say to me. And it was a very confusing time for me. I didn't know how to process my emotions, and I definitely didn't know how to articulate them to my husband. And so we started to have a lot of challenges in our relationship, because he's very extroverted and wanted to help me, and I'm very introverted and didn't know how to let him know what was happening. And so there were nights where I would be alone in the bedroom and he would be in the hallway, and I remember him trying to talk to me through the door, because I was just like, leave me alone. I don't know what's wrong, and I don't know how to tell you to help me. And he was, again, we had only been married for a year, so he still wasn't tired of me, thankfully. And I remember him calling, trying to get someone to help us, because honestly, we had never had anybody talk to us about potential, what the medical field calls psychosocial issues, or what I refer to more as emotional or mental health challenges that you're faced with from going through a cancer diagnosis. So it took about 9 months, and he found a counselor who, she was a psychologist that thankfully was a survivor. And he made an appointment, and really, he had to pull me there, because I was very reluctant and didn't believe that I really needed that kind of help or even wanted it. It was a really scary time, and thankfully, I decided to go. And from the first time that I met with her, really, she just started to share her own story with me. And as she started to talk about the grief that she had gone through from um, just losing a sense of normalcy, from not having breasts anymore, from losing her hair, from the dreams that she had for her future, all the different layers of grief. She started talking to me about that, and it really resonated with my heart, and it validated my own hurt. And so at that point, I started seeing her regularly, and my husband and I really started to get some tools to be able to learn how to communicate. She basically was like a translator. So everything that I was feeling and thinking, she was able to translate to him exactly what I was feeling, which helped him to have a better understanding of what I was going through. And so at that point, it was about, I would say 2005 at that point. We had gone to her for several years. And I really just had a passion to want to come alongside other women and their families, because I knew that we couldn't have been the only people out there struggling like this. And I knew we hadn't been the only people out there that were never um, talk to about potential challenges on the other side of the diagnosis. I feel like the medical community does a wonderful job of diagnosing, of treating, but then oftentimes it's like the day you leave or the day you finish and you ring the bell, it's like, see you later, have a great life. But there are not a lot of resources available for us to maybe start processing our post-traumatic stress or grief or communication, whatever challenges that might arise. So at that point, Steve and I decided that I wanted to start a nonprofit to be able to initially raise funds to offer financial scholarships to survivors and their families. And so that's where we started. It was in 2007, and we called it Project 31. And I'm a Christian woman, and the book of Proverbs in the Bible really resonated with me. It's a chapter about a woman of noble character. And the verse that really stood out to me was Proverbs 31:30. And it says, beauty is fleeting, and charm is deceptive, but a woman who fears God is to be praised. And I really felt like God had comforted me by letting me know that even though all the beauty on the outside might have been taken from me per se, but it was what was on the inside is what truly mattered. I think breast cancer specifically is especially challenging for women because it takes pretty much or it tries to take every part of who we are as a woman, from our hair, our breast, our fertility, our intimacy, everything about us as a woman. And so I really wanted to empower women to know that there's more to you and that you can have a fully restored life after cancer and that it doesn't have to dictate your identity for the rest of your life. So that's where we started. That was in 2007. And I was still working full time. Thankfully, I had been able to have 2 children at that point. And fast forward to 2011, I realized that because of HIPAA, that it was hard for me to connect to patients. I couldn't call an oncology office or an imaging center where I felt like would be a good place to intersect with patients and ask them for a list of names. So I was like, how am I going to bridge that gap? And so I just created what we call at Project 31 a Handles with Care. It's essentially a care package that's curated by survivors for survivors. It has practical items in it that we can use, and it was intended to be a gift and a way to introduce them to Project 31 and also establish a relationship. I just realized the need for other survivor relationships. My friends and family they loved me and they were a great support, but I needed that voice from another survivor who understood specifically what I was feeling. And oftentimes, I feel like, I don't know if it's like this for you, but as patients, I feel like a lot of times we guard our emotion because we're wanting to protect our family and our friends, because sometimes the things that we think about are too hard for them to handle. And yet, it's still something that we need to process. And so I felt like that would be a great way to be able to bridge that gap. In 2011, I was approached by the imaging center where I was diagnosed, and they asked me, thankfully, they were intuitive enough to know that a support group being led by a peer would probably be more impactful than having a social worker or nurse navigator. Not that they're not great, but it's just a different voice. And so she had contacted me and asked if I would consider leading a group. And honestly, I really didn't want to, because in my mind, I had stereotyped a support group to be pretty toxic, or a place of just negativity and despair where people would just stay in that yuck of cancer. And that's really not who I am. I wanted to create an environment of hope and encouragement where women and their families could come and be educated, they could be validated and empowered to have some tools in their belt and really live a life of fullness beyond cancer. So at that point, I agreed, yeah, I'll give it a shot. And so thankfully, one of my partners, she's our CFO now, she had come into my path and we decided that we would do this together. I felt like it would be easier to do it with a partner than by yourself. And so in May of 2011, we launched our first support group, and we had 25 people show up that day. And then at that point, I realized, okay, there really was a need. And from that point until now, we've really just, I think, done a good job of creating a sustainable model that really provides education and support to women and their families. What we like to do is assess the needs of the women coming through, because there's usually new people coming through at all times. And we thankfully have some relationships with great professionals that we are able to ask them to come and share. So, for example, we have plastic surgeons, we have breast surgeons, oncologists, we have pelvic floor specialists, nutritionists, physical therapists, and then we have therapists that come on as well, just to talk about post-traumatic stress, about EMDR, different techniques that you can use to help walk through your journey with cancer. So prior to COVID, we were collaborating with 10 different hospitals in the state of Oklahoma. That's where I live. And we have a leadership team of 20 survivors. So the way we do it is we have 2 survivors at each hospital. And so they really are loving on those women individually, checking in with them, going to treatment with them. And then obviously last year put a kink in that chain. And so we had to adapt and move to a different model. And that's why I'm grateful to be here today, because now we're offering 2 online groups each month. So it's the first and third Tuesdays of the month. we have different speakers that come on. And so our goal is really to create community and to educate women, especially this day and age when we don't have a lot of hospitals open at this point. People are very isolated, and that is my heart, to let people know they are not alone and that there are other people out there who understand. And so if those of you out there are going through breast cancer and you would like to have a community of support by other survivors, we'd love to have you. So check out our website. It's project31.com, and feel free to like our Facebook page. And if you'd like to connect with me individually, you can email me. My email is Sarah, SARAH, at project31.com. So thanks for listening today and letting me share my story. I applaud you for your journey, and I pray that you know that you're not alone and that there are a community of people who care for you and understand. And I hope you have a great day. Thank you.